Bonjour tout le monde. Good morning, everyone. My name is Linda Barber, and I'm the branch manager of the Ottawa branch of the National Association of Federal Retirees. I would like to begin this morning by acknowledging that the land on which our office is situated is traditional unceded territory of the Algonquin and Anishinaabe people. On behalf of the Ottawa branch, I'm pleased to welcome you to today's webinar entitled, Let's Talk About Men's Health. This is presented by Meg Stickl, the owner of AIM Fitness, who we've been working with for a couple of years now. And we would also like to welcome our guest speaker, Dr. Sandip, Naturopathic Doctor with the College of Naturopaths of Ontario. Today's webinar with Dr. Sandip will cover the topics of heart disease and diabetes. He will review and explain the importance of lab tests that are specific to these conditions and answer questions about other specific risk factors that could be unique to your situation. So we welcome both Meg and Dr. Sandip. Veuillez noter que le webinaire sera présenté en anglais, mais la présentation bilingue est toujours encouragée. Now, I want to give a special welcome to anybody here who is not yet a member of the association and you're just trying us out. We hope the webinars we offer will inspire you to join us. And to the folks who are members, we dearly hope that these webinars encourage you to maintain your membership. And just a reminder, if there's any gift occasions coming up, you can always give the gift of membership. And to learn more about how to give the gift of membership, we're going to include I think there'll be something in the chat link, and then we'll also send something in an email after the webinar. In fact, probably in the afternoon, what we'll do is send you a full email with instructions on how to access the recording of today's webinar and how to give the gift of membership. And we just want to remind you that for future webinars coming up, you can always invite guests to try us out for free. That's enough commercials from us. There's going to be a question and answer period at the end of the webinar, and all you'll have to do is type your questions in the chat box, and Meg will be reading them out loud to Dr. Sandip, and he'll be able to answer them. So now I'm going to turn it over to Meg.
All right. Thank you, Linda. So before we get started, I would love to introduce Dr. Sandip, and I want to thank you for being our guest speaker today. After completing his Bachelor of Science in Cell Biology at the University of British Columbia, Dr. Sandip attended the Allopathic Medical School and noticed the lack of emphasis on disease prevention and health promotion in patient care, specifically using nutrition and exercise. While completing his training at Wyckoff Heights Medical Center in Brooklyn, New York, Dr. Sandip was able to make this sustainable lifestyle change in his own life. This was the driving force for him to pursue naturopathic medicine. Dr. Sandip has years of experience in treating complex cases with natural treatments, including acupuncture. His treatment philosophy is working with patients to find solutions that work for them and their lifestyles. He is a registered naturopathic doctor with the College of Naturopaths of Ontario. Now today, Dr. Sandip will cover the topics of heart disease and diabetes. He will review and explain the importance of the lab tests specific to these conditions and answer any questions about other specific risk factors that may be unique to you and your situation as family history. He'll discuss in detail what you can start doing today to prevent your risk of developing both conditions, and also discuss the role that lifestyle and naturopathic medicine can play as an adjunct in managing both heart disease and diabetes if you've already been diagnosed with these conditions. So Dr. Sandip, I'm going to turn it over to you. Thank you so much for being with us today.
My pleasure. I'm really happy to be here. Thanks for that beautiful introduction, Meg, and AIM Fitness, everybody with the team. So we're going to talk about heart disease today. So I focus on men's health in my practice, but this talk is going to be for men, women, and pretty much anybody, even if you are living with heart disease as well. So we can get started. I'm going to share my screen here. Okay, now let's pull up a presentation. Can everybody see that? Good.
Yeah, looks good.
Great, awesome. Let me get started. So my name is Dr. Sandip Opal. I'm a naturopathic doctor, and I also studied conventional medicine in the past. I switched into this medicine partly because of a personal story and just the fact that I started getting healthier as I got older, and I thought that was amazing. So That's kind of how I practice. So we'll talk about understanding heart disease. So a little bit of an outline. We'll talk a little bit about statistics that are specific to Canadians called atherosclerosis. And then we'll talk about another process called metabolic syndrome. We'll look over some lab tests that are relevant. And we'll talk about risk factors that are specific to you and what you can do today to start lowering those risk factors. We'll talk a little bit about heart healthy foods, and then we'll talk about foods to avoid. And the last part will be kind of a little bit what I do, so like naturopathic management of heart disease.
Sorry, Dr.
So,
Sandip.
Heart disease.
I'll just have you, if you could share your main screen or start the slideshow, because we can see all the slides on the side.
Okay. Well, I had some notes at the bottom of it. You mean like do you like this screen?
Yeah, can you do like a slideshow?
Like this?
Yes.
Oh, okay. Yeah, I had some notes at the bottom of it that I wanted to look at.
Okay. Okay, well, that's fine.
Were you guys able to see the screen when it's like is it visible like when it's like this?
Yes.
Okay.
That's okay. Okay.
Yeah, that's fine.
Yeah. Should I can make it bigger or?
No, that's good. I think we can see it well. Yeah, sounds good.
Okay.
Thank you.
Yeah. If anybody has trouble seeing it, I can try to switch to the other part. But
no, this
yeah,
is
I
fine.
can do that.
This is fine. Yeah,
okay?
no, you keep going. Thanks.
Okay. So heart disease is the second leading cause of death in Canada, and then 1 in 12 Canadians are living with diagnosed heart disease. And every hour, 12 Canadians aged 20 plus with a diagnosed heart disease will die. So this information is gotten from Public Health Agency of Canada in 2017. So that's quite a bit of the population. So it's a really significant disease that I think a lot of the time is overlooked, but it's pretty prevalent. So it's something that we should be focusing on. So what is heart disease? Heart disease is a number of problems that develop from changes in the blood vessels, including the ones that supply the heart itself. So those are called the coronary arteries. So we have blood vessels in all of our body, which the heart pumps blood to, but we also, in order for the heart to do that, it needs to have arteries itself in order to get it to do its job. So a couple of conditions can develop. So the first one is called an angina. People may have heard of. So that's a temporary or partial decrease in the blood flow to the heart. So the heart it's a muscle and it needs oxygen and nutrients and things to do its function. So when it doesn't have those oxygen and nutrients, the cells begin to kind of start dying. And it usually happens after 20 minutes. So that's what's called a heart attack. And it usually happens when there's a complete cutoff of the blood supply to a part of the heart that results in permanent and irreversible death of heart tissue. So that's kind of the tissues of the heart will die and they can scar, and we never get them back. It's similar to when we get a stroke and they tell you to go to the hospital really quickly, or so you can have irreversible damage. The brain works the same way as the heart. So we only have one heart, and it's really important to take care of it. Our heart can function with having death of cells and scar tissue. And that's where we start seeing things like people that have pacemakers, or like when they do that EKG test, they'll have different like movement of how the heart works together because there will be scars in the tissue. So we want to prevent a heart attack, right? Because it happens and things become harder for us down the future. And the way that there's a complete cutoff of the blood supply to the heart usually happens from a blood clot, and it occludes an already narrowed artery. So we'll talk a little bit about these things that happen in atherosclerosis, so we get a little bit of a clear picture on that. So when we talk about a plaque, it's a narrowing of the arteries over time that results in reduced blood flow. So this clot is made up of a few things. So it's made out of cholesterols, which is where we might want to manage our cholesterol levels. We'll talk a little bit about the importance of that, because it's also composed of other things like fats, fibrin, calcium, and other like cellular waste products. And what that does is it causes narrowing of the arteries over time. In addition, for the plaque to start to form, there has to be inflammation or kind of like damage in the arteries. So usually cholesterol is supposed to freely flow through our arteries. But when you have a damage in the interior part of the wall, then things can kind of start to stick. Can I talk a little bit about this? Yeah, so we want to focus on a couple of things, you know, preventing a clot from forming and keeping our arteries healthy, right? Okay, so the next part talks a little bit, has a bunch of photos. Can everybody see the arteries and the narrowing of the arteries, that part? So this is kind of what the plaque is right here. If you guys can see my cursor. So the plaque develops and blood can still flow through. You kind of like, if you think about like old pipes in a house, that's kind of how our arteries work. So it starts here and it progresses. And then it can be narrowed to a certain percentage, so less blood can go through. So when we talk about people who have heart attacks, a lot of the time it happens when they're doing a vigorous activity or like shoveling the snow, or people start having chest pain when they're walking up the stairs. And the reason for that is when we're moving, or the rest of our body needs blood, and our heart has to pump harder and faster. So it needs more nutrients in order to do that, and like more oxygen, right? It has to breathe more. So a lot of the time when there's less blood flow, that doesn't really manifest until we're doing a vigorous activity. The other way that it can manifest, which can cause a direct heart attack, is through a clot. So you see this artery here that's already narrow. There's a little bit of space for blood to go through. If further downstream somewhere else in the body, like even like the leg, there's a clot that bursts and starts traveling through, it can narrow it even more, and it can do it like suddenly. So that's kind of what a heart attack is. And this kind of just is the same slide, but it talks about these arteries that supply blood to the heart. What else did I want to talk about here? Okay, I think that was it there. You have any questions in the chat? The chat box is open a little bit.
Yes, yeah, we've got 3. So
yeah, I can. I can do them as we go along, so then I won't have to go back to the slides. So
sure, yeah. So the first one is, can you have had a heart attack and not known it?
Oh yeah, definitely. So 100%, you can have a heart attack and not have known it. The symptoms are different for males and females. Women usually present with more like nausea or like stomach pains and things like that. But you can definitely have heart attacks. So there's a couple ways to know if you've had a heart attack. So once things start happening, so obviously, first of all, if you're having severe chest pain that's relieved by sitting, by leaning forward, shortness of breath, and you feel like you're like have nausea and sweating and things like that, you go to the hospital right away, right? But it doesn't always present like that. Sometimes, especially like in women, it won't present like that. So there's something called the EKG, which is like that. Those squiggly lines that people always see. So that's a heart test. So in that EKG, we see how like there's neurons that are firing between cells that cause the heart to beat in this rhythmic fashion. When we have death of the tissue that will scar after, that'll show up on that EKG. It's very specific wave. So when the doctor looks at the EKG, they can be like, oh, this was a heart attack. We can't say when it happened, if it's happened after 3 weeks. But it definitely can show up for after years. If you've had a heart attack like a week or 2 ago, there are some blood tests like LDH and things like that your doctor should order that will show, hey, you know, you had a heart attack. So one of them lasts a week in the blood. It's just death of the tissues. And another one lasts 2 weeks. Another one lasts 3 weeks. Your doctors usually order those, especially if you go to the ER. The second way you can see even further progressed disease, so it's called an echocardiogram. So you see an echo, you go to the doctor and they'll put like an ultrasound gel on you and you'll be lying on your side and they'll be moving this gel and ultrasound. And they're basically getting a picture of the heart, again, how it beats and how the blood flows through. And with that, they can see if you've had a heart attack. And that usually is in patients who've had heart attacks. So they continue to monitor how well is your heart pumping blood, right? How well is it like moving in this like lub-dub, like beating fashion? So yeah, definitely good question.
Really good question. Thanks for answering that. So here's another question. As a naturopathic doctor, what is your take on Crestor for cholesterol and Diovan for high blood pressure? Are there alternative medicine in naturopath?
Oh yeah, definitely. So we'll talk about that. So Crestor it inhibits like the cholesterol production. So I have a bunch of slides on that. So I think it needs to be looked into better detail. Statins are one of the highest prescribed medications, top 3 in like North America. But cholesterol actually plays a really important function in our cells, in our body. It makes all of our hormones. So the balance needs to be looked at. Yes, it's part of the plaque, but it's not the full part of the picture. So I'll talk about that in lab testing. There's a lot of other things like inflammation and other things that make up the clot. So 50% of people that have heart attacks have normal cholesterol levels. And that's just been something that's been being uncovered in the conventional world just a few years. And I feel like a lot of other doctors don't pay attention to that, but it's definitely something that I pay a lot of attention to. So we'll talk a lot about that. And then there are also natural ways to reduce blood pressure. So even diet and exercise can reduce our blood pressure by what's called 10 systolic points. So usually people's blood pressures are from like 120 to like 150. So that's quite a bit. Diet, exercise can reduce weight, but there's also herbs and things that can reduce blood pressure. And in terms of blood pressure, I do have patients that are on blood pressure medications if they need to be on them. It's just not the first thing that I go to. So management of blood pressure is really important. And I talk a lot about that too in the lab tests.
Okay, awesome. 2 more questions and then we'll move on. Besides having a stem, are there medical procedures that could be used to clean the arteries?
There are. So stem and stents and things like that kind of clear out the blockages that we were looking at. So there are things like angioplasties and other things like that as well. So a lot of what I focus on is preventing getting to that point. But there are a number of things that can be done. And a lot of it is based on, like whether you are having a heart attack and you get to the hospital in time or whether it's an emergency. Also, it depends on how narrowed the arteries are, so like the percentage and how much they're narrowed.
Okay, good. Yeah. And then maybe this one is kind of the same type of question, but can you reduce or remove plaque buildup?
No, you can't. So at that point, you need to either get it like cleared out, or sometimes they'll bypass the arteries. So a lot of it is prevention. And even if you do have a plaque, so forming plaques in our arteries is normal. So the process of atherosclerosis, like deposition of cholesterol, actually starts at like when we're teenagers. But it starts in the bigger arteries and it doesn't cause an issue. It's an issue when it happens in the smaller arteries over time. But once it's formed, like a blood clot can break off the plaque. But for the most part, that plaque is stayed there. It stays there. If you think of like cleaning out a pipe, you really got to go in and you got to get that little swivel thing and like pull and clean out the pipe. And the rest of it is prevention. It's not like there's Drano or something that we can put into our body to clear. So that doesn't. Yeah, if only it'd be a lot easier.
Yeah. All right, that's all the questions for now. And then just if you could make the image, kind of as big as you could.
Yeah, I can.
As you continue, then that would be great.
I'm not even using my notes really. If I do, I'll just come back to it.
Okay, perfect.
Okay, how's that?
Oh, wonderful. That's great. All right, thanks for answering those questions.
Yeah. So metabolic syndrome. So this is kind of like a tetrad, so like 4 conditions that are put together that are all really high risk factors for heart disease. So the first one is high blood pressure. High blood pressure is really important. So I'll talk about these in context and what they do to your heart. So high blood pressure, what it does is it puts more of a demand on the heart. So it's kind of hardening of the arteries. So we have more of a pressure along along the artery wall. So what it does is it makes it harder for the heart to pump blood. So again, it has that increased demand. It needs more oxygen, it needs more nutrients. And over time, the heart can also enlarge a little bit too. So blood pressure is really important. It's also important in terms of stroke. So that's something that you always want to maintain and monitor regularly. So high bad cholesterol. So there's different types of cholesterol. There's good and bad. I'll talk about that later. So high cholesterol definitely is a risk factor. And I'll talk a little bit about how it is a risk factor. So the plaque is made out of cholesterol. So the bad cholesterol is referred to as LDL cholesterol, which you might see on lab tests, which basically stands for low density lipoprotein. So our cholesterol, we ingest it and do also make it in our body, but it's normal to have in our body because we need it for cellular functions, and it makes up our cell walls and hormones and things like that. So what our body does is we eat it and it goes through something called an enterohepatic circulation. And that basically just means from like our tummy, our gut to our liver. So our liver is what processes the cholesterol, and it processes it with these proteins and adds in cholesterol and fat, and then they're shunted back up to the bloodstream so they can go to where they need to go. But what happens is when they're traveling in the bloodstream, they get stuck and they lose some of the fat, and they start depositing cholesterol onto the walls of the arteries. So that's what makes the cholesterol bad. So when we look at LDL cholesterol, there's actually different types of the cholesterol. So a good analogy is, so that they're circular molecules. You think of like a beach ball versus a golf ball. So a beach ball is like big and fluffy and it'll bounce around. So that's what we want, to not get stuck in our arteries so it can go to where it needs to go. But the golf balls are small and dense. So if there's a little like, kind of like a pothole in a road, so like in our arteries, like a little like damage or something like that that's happened from somewhere, the little golf ball can get stuck in there, and then after that things just start building and more golf balls are coming, and then they're all getting stuck with calcium and all these other things. So that's why cholesterol is bad, but it's not the full picture, because cholesterol is meant to normally flow throughout our body. High blood sugar is a big one. So this one's big because it's one of the things that damages our artery walls. So we want to manage our blood sugar, and our blood sugar is something that also causes inflammation. And when we have sugar in our blood, we also have insulin in our blood, and insulin can also cause types of inflammation as well. So high blood sugar is a really big risk factor for heart disease and metabolic syndrome. And the last one is that stubborn tummy fat, the abdominal obesity that like everyone has a little bit of, but there are certain levels where you measure to try to see if it's too much abdominal obesity. And the reason why it's so bad is it stores a lot of our excess energy. So there's something called triacylglycerides or tags that your doctor might order. We'll talk about later. So in that area, there's triacylglycerides, and there are all these energy reserves of fat. And they're stored there. And then again, when we need them, if we need them, they will release into the bloodstream. So that's fat releasing into the bloodstream. And the triacylglycerides are actually really predisposed to sticking to the artery walls. So when we look at all these conditions, it's kind of like, occlusion of the artery wall, so we don't get enough oxygen to our heart. High blood pressure causes too much demand on our heart, so it needs more oxygen and more blood, but we can't give it to it, and blood sugar starts the whole process. So this is called metabolic syndrome. Yeah. Any questions about that? Or okay, so risk factors. So can everybody see the diagram on the right side? Or is my, okay, yeah, because I see the pictures on the right side. So I'll move this over. So one of the biggest risk factors is smoking. So my advice for smoking is stop smoking. That's kind of the big thing. And if you're smoking, you want to try to cut down. So this talks about cutting down on smoking. So after 1 year, after quitting smoking, the risk of coronary heart disease is half of that of a smoker. It takes about 15 years for your risk of heart disease to decrease to someone who has never smoked, but it is possible. And then in between that time, your risk of stroke is reduced to that of a non-smoker. And a stroke is the same thing as a heart attack, but it happens in the brain. So it's from a clot, and it's a decreased blood supply to the brain. The reason why smoking is one of the many reasons why it's so bad is the fact that it causes that inflammation again. It damages the artery walls, and it also constricts our arteries as well. So our arteries can expand and constrict because they have muscles in the walls. And again, if the pipe kind of closes and narrows, then less blood can go to where it needs to go, to like the heart or the brain. And once we don't have enough blood going to our cells, is basically like strangulation, right? And that's kind of what it does. So there isn't much of a benefit. I know it's hard to quit smoking. So I smoked probably from a teenager up until like actually medical school. So a lot of doctors smoke, which is just terrible. I still remember, but when I got into the natural side of things and I fixed things up, that's when I stopped smoking. But it's hard. I think it took me like 8 years of stopping and trying. So I've helped patients with it. A lot of it is kind of like therapy-based things. You need to have someone who gives you accountability and advocate for you. But there's also things like acupuncture that are also helpful as well. But yeah, so it's just kind of a habit thing. And I know it's really hard, but it's something that I really think needs to be done. And it can be done like later on in your life. It's never too late to quit smoking. In 1 year, like you decrease your risk, right? When you've smoked for like 20 years, right? You just don't do it for 1 year. Like our lung tissues start to rebuild, the inflammation, the root cause of inflammation is out of our body. So that's kind of how that works. The other one is family history. So it's important to find out family history for heart disease, diabetes, and even strokes and things like that. And then it's also important to know who the family history is in. So whether they're a mother or father, and is different by male or female, or a sibling or an uncle or aunt or a paternal or maternal grandparent. So for this, I have to look at my notes for the exact numbers. So here, it's if men who are less than 55 years of age or women that are less 65 years of age, because heart disease is more of a risk factor for men earlier on. If you've had a father who had a heart attack at like 52, that's a risk factor. But if your mother had a heart attack at 52, later on, it's not as much of a risk factor. It's 10 years later for women. So, and the percentage of having a heart risk event also is different for men, women, and parents or siblings. So if you had a father who had a heart risk event before that age, the increased risk of having a heart event is 75%. If it was your mom, it's 60%. And if it's siblings, it's 40%. And there's also something that's called ApoB100 protein. And what that is something that is a genetic protein that's produced in the liver. And oops, try to like open the screen again. There we go. So what that protein is, it's one of the proteins that processes the cholesterol. So our proteins are encoded by genes, and that's kind of like a genetic factor for us. So some people make less or more of that protein, and that can affect how much of the cholesterol is transported through your blood. That's an important test to look at. The next risk factor is sedentary lifestyle. So sedentary lifestyle pretty much means inactivity for prolonged periods of time. So if you're sitting for like more than 12 hours of your day, for example, if you sit at work all day and then you come home and you sit and watch TV with the remote, so that'll put you into a sedentary lifestyle. So there's a couple of things that you can do to prevent that. So one of them is just getting up and moving. Like every 90 minutes or 60 minutes. So I have patients that are moms, and like they'll be doing things from moms are always moving, but they'll be waiting for something in the microwave or the oven, and they'll just do like 10 squats, right? And what that does is it moves the blood in your body, and it doesn't allow things to kind of like sludge and get stuck in the arteries. And then another part of it is to try to get a certain amount of exercise like in the day, but more of it is you shouldn't be not moving for more than like 12 or 13 hours a day. And when you factor in sleep, you kind of, it gets really hard to do, but there's little tricks and things that you can do. The last one is stress. So stress is like an issue for a lot of people, and it causes a lot of inflammation in arteries. It also causes our heart to beat faster when we have anxiety. So it puts more demand on the heart. So we'll talk more about stress management strategies too. But these are major risk factors. So if you have one of these, like a family history, or you smoke, or you have a sedentary lifestyle or a lot of stress, then you want to kind of start looking at, getting yourself evaluated to see what is my risk of having a heart event. There's a lot of tools that we can use. So these risk factors that are here, our management of like what we want your cholesterol levels to be at, what we want your blood sugar to be at, you know, whether you need to be on medication or not, they all change with these risk factors. So if you smoke, you're at a higher risk. So you want to be like more cautious because you have something that's going on, right? And family history is one that I have, and that's something you can't change. So that can be difficult sometimes, and that's something that I face a lot, which is what made me kind of get into this field too. So
awesome. Now we've got two questions that have to do with risk factors. The first one is this: I had an MI in 2015 and am still on medication, but still get shortness of breath when walking. Why is this?
Yeah. So depending on how old the person is, so a lot of the time, so when we have the myocardial infarction or a heart attack, again, like the heart tissue dies, and it makes a little bit, depending on how long it's been happening for. So for example, if people have had a heart attack in the past and, you know, like it's been like 10 years or 5 years or something like that, eventually the heart isn't again able to like pump all of the blood out of the heart to the body. So our heart is connected to our lungs. What can happen there is sometimes if the heart isn't able to pump out enough blood, the blood kind of starts to back up, and they can back up and go to an area of our lungs, which presents as like water in our lungs a lot of the time, and also like swollen legs and things like that. So that can cause shortness of breath. And that's called heart failure. So that happens over a period of time. So there's different classes of it. Is class 1, 2, 3, 4. So the first one is mild, and the fourth one is it's very hard to breathe once that happens. So what you can do about that, if heart failure is what the person has been diagnosed with, so it's controlling the amount of water that's in you. So they'll give you medication to pee out all the water, but there's other ways to do it too. So like weight loss is one, definitely, and then also like watching salt in your diet, things like that. But it's pretty much like an overload of fluid that's backed up because the heart can't pump it around the body.
Okay.
There can be other causes, but that's the most common cause of shortness of breath for someone who's had an MI.
Okay. All right.
Yeah.
Thanks. All right. The next one has to do with smoking. We know a lot of people are vaping these days. So how does vaping compare with smoking as a risk factor of heart disease?
It hasn't been studied specifically for heart disease yet, because that's just how it works. Something new comes out, it takes time to like see the data and information. So there's no guidelines on it. So then I focus on like what I know about it and kind of like my clinical experience with it. So vaping, I don't recommend it. It is better than smoking in terms of like inflammation and all those kinds of things. But it also deposits things into your lungs as well. So it causes the shortness of breath. But smoking there's no like official risk factor. The studies haven't been done because vaping hasn't been long enough. I don't recommend for people to do it. And if I had to give an opinion, it's not as bad as smoking in terms of heart disease. Yeah, like the big thing with smoking is it causes inflammation and damages the artery walls. It also is like nicotine constricts our arteries as well when we take it. So it depends if you're smoking, if you're vaping nicotine or not nicotine. It's better to do not nicotine, but it's not good.
Okay, awesome. Very interesting.
Yeah.
Thanks for sharing that. Great questions, everyone.
Yeah, I love all the questions. I love questions. Okay, so I'm going to talk about lab tests, but before I can, like blood pressure is so important. They have those blood pressure monitors. You can use at home. They have them at like Shoppers and Walmart, all those places. So I really recommend everyone to do them. And the way you want to do it is they'll guide you on the ones that they have there. You want to do about 3 readings, and you want to do it like a few times a week, because it can change from small things, and you want to keep a record of what the blood pressure is. Like if your blood pressure, it can go up to like 148 or something, and it doesn't mean immediately something bad's going to happen to you. It's over a long period of time. because we can handle small stresses, like our heart rate will go up sometimes, but we want to make sure that most of the time our blood pressure is good. And there's also, there's a lot of data on overnight blood pressure too. An increase in blood pressure overnight, it's related to things like sleep apnea. That, I don't remember the exact details. I was reading a study about it, and that is a really big risk factor. So you want to make sure overall your blood pressure is good. Oh, so it's categories here. So they actually changed. There was a study called the SPRINT trial that was done just 3 or 4 years ago. It was a huge study, controlled, all that kind of stuff. And they became more strict on the blood pressure guidelines. So normal blood pressure is less than, there's two numbers. The top number should be less than 120. And the bottom number should be less than 80. And if it's above 120, we call it elevated. So that's something that needs to be watched. And then if it goes above 130, so that's technically hypertension, just means blood pressure, is diagnosed as high blood pressure. And then the bottom number goes 80 to 89, that's also diagnosed as blood pressure. Before, we used to kind of monitor people dependent on their age, and the age was 55. So as we get older, let's old types again, our arteries will start to become less elastic and will harden a little bit, and that's what causes a high blood pressure. But now they're recommending it for any age. I found it can be kind of stressful because that put a lot of people in as diagnosed as high blood pressure. In the last few years, it wouldn't have been, and I understand how that can be stressful. But then again, it's more of over a long period of time. If you have a little bit of blood pressure for a few weeks or a little while, it's more important to have it controlled over the long term. But that's technically what the guidelines are. They might not be updated on the machines, at shoppers and pharmacies yet, but it's new. It's from the American Heart Association. Okay, so we'll talk about the lab tests. So we'll talk about the cholesterols. The first one is HDL. So that stands for high density lipoprotein. So that's a good cholesterol everybody always talks about. One of the reasons why it's good is it has a different amount of proteins in it and is packaged in the liver, but then also it actually cleans up our arteries and it picks up leftover cholesterol from the bad cholesterols and takes it back into the intrahepatic circulation. So this one is something that kind of cleaned our arteries up. And it's also related to the next one. So TAG stands for triacylglycerides. And what that basically is fat in the blood. And that's kind of what comes from the tummy fat. So this can be increased from eating things like packaged foods, and also things like baked goods, and then there's a few other things. So here, I had the levels here I wanted to talk about as well. So unlike cholesterol, this TAG or triacylglycerides are fat. They're not necessary for our body. They're just extra reserves of energy on production, so we don't need them. So that's why we want to have decreased amounts of them. So the numbers here, normal is less than 1.7, borderline can get to around 2, and high can get from it is pretty bad. But this cholesterol can be normalized by the HDL that clears up our arteries. So if we have maybe a little bit of this, but we have more HDL, it makes it less worse for us to have the triacylglycerides if we have more HDL. So they're basically in balance. So when we order the lab test, we do it in a ratio. So some people can have, high triglycerides, but then also high HDL, and it kind of balances out. Whereas some people can have, very low HDL and okay triglycerides. And when we do the ratio, it ends up being almost the same. So those are two important blood tests, and they're always ordered. The last one is the LDL. So I talked a little bit about that. That's the bad cholesterol. So that is actually measured as one unit, but it's actually composed of other types of cholesterol. There's something called VLDL. It's very low density lipoprotein. So in the current labs, what they do is they kind of combine them together and they look at it as an average. But what that does is it doesn't tell you like the ones that are golf balls or the ones that are big fluffy beach balls. So there's a couple of tests that do that, and that's called the NMR lipid profile. So what that does is it actually looks at each molecule of cholesterol, and it tells you how many molecules of the good one, how many molecules of the golf balls and how many molecules of the beach balls you have. And that makes a really big difference, because when this test combines them together, it doesn't account for the difference. So some people can think that they, you know, have the like the bad cholesterol that can cause like plaque formation, but they won't know until they get the lipid profile test done. So versus doing an average, this test looks at each molecule. And let me just see if anything else I wanted to say about that test. Yeah, that was pretty much it. Go to the next slide. And the next slide is blood sugar. So these are really important too. So the first one is called the hemoglobin A1C. So that's just a fancy name for looking at our blood sugars. So the way that it works is we have sugar in our blood, it circulates around, but it's really sticky. There's a process called glycation where like the blood sugar will stick to everything. So for example, it'll stick to like the arteries and things like that. And hemoglobin is a part of a red blood cell. So it sticks to it. And what we've done is take advantage of that to measure levels. So this hemoglobin A1C, it measures how much blood sugar is stuck to the hemoglobin, but what it does is it's reflective of 6 to 8 weeks of blood sugar in our body. So it again gives an average. And what I don't like about it's a good test to do, but it's not as specific as it can be. So each time we eat sugar or glucose, we get a spike in our glucose levels. So we can eat a donut and we'll get a spike in glucose levels. And that happens like multiple times throughout the day, and there's different changes each day. This test doesn't account for that because it only looks at the average. So this is when you see diabetics that are finger sticking. That's the reason why they do that, because they need a more precise measurement of their blood sugars. So there's a couple of things that have come out. One of them is called CGMs, and that's called continuous glucose monitoring. So they're like all the new rage. They're pretty expensive right now, but they'll be cheaper over time. So they're a sensor that's usually put on your arm, and it senses your blood sugar in real time throughout the day. So you'll know, when you're eating something like how much did it increase your blood sugar. Why that's important is you can read the package of something and read the amount of sugar that's in it, but blood sugar increases, there are so many different factors. So it increases differently in each person. It increases differently if you do exercise after eating. It increases differently if you eat vegetables before eating sugar, or if you combine it with protein or fiber or things like that. So we can never really predict how much blood sugar spike will happen in our body by using something that has like a 6 to 8 week span. So that's why these are really good. I do recommend them for people to use. And now what they're doing is there's a couple of companies, one's called January AI. So they're pairing with artificial intelligence. So they're kind of linking up this huge database where people will eat a certain food, and then it'll track how much glucose is increased. And then we have a better picture of, how much is glucose increased if you eat a donut and are sedentary only on the couch, versus how much does glucose increase if you eat a donut and go for a walk, right? So the levels are all different. So that's why that's important. And what it can do is it can tell you, can I eat this? What effect will it have on me? And how much will I need to exercise? Or can I not exercise? Or did I not exercise and can I eat this? So that's like the new future of management of glucose, which I think is like amazing. The last thing, which is so these aren't all of the tests to order, but one of the tests that isn't ordered that I really think should be ordered is fasting insulin. So insulin goes hand in hand with glucose. So insulin is kind of like, if you think of like a key, and glucose is your visitor, and your house is your cell, and the insulin is the key to open the door to get into the house, to let the visitor in your house. So if our insulin isn't working and the keys aren't working properly, then we need to, our pancreas will throw a bunch of keys and be like, try this key, try that key. What ends up happening is we have tons of insulin in our body, in our blood. So that's never measured. What people usually measure is the glucose, right? So when we're measuring the fasting insulin, we're seeing how much insulin was needed in order to decrease our blood sugar. So that's pretty much diabetes, right? That's kind of how diabetes works. So if we just measure the glucose, which a lot of doctors do, and don't measure the insulin, someone can have a lot of insulin in their body and we'll never know it. And insulin, again, causes damages in the artery walls. It's a huge inflammatory factor. So I've had one person who had normal glucose levels and hemoglobin A1C, etc., but her insulin was like through the roof. So that's something that kind of needs to be looked at. And she had chronic disease as well. So that's an important lab test, I think. Yeah, so this is also a really important one. It's called HSCRP. So it's a blood test that's specific for inflammation. So there was a huge study called the Jupiter trial that was done in like 17,000 patients over 23 countries, published in the New England Journal of Medicine. And what it looked at again was that a cholesterol picture, so like what statins work against. So there are 50% of people who have heart attacks and heart events who are getting stents. They have normal cholesterol, and then their cholesterol is still normal, but they'll still have another heart event or an angina or be back in the cath lab. So what this test looked at was the missing piece of the picture, which is HSCRP. So that's inflammation that's specific to the heart. So CRP it's a protein that's made in the liver, and HSCRP is specific for heart artery inflammation. So what this study showed is it got cutoff levels to see, hey, this biomarker is increased in people who have had heart events but had normal cholesterol levels. So it's a really affordable, very easy test to do. You can do it at Life Labs. It's a blood test, very simple. But it's something that not a lot of people do. And I think maybe one of the reasons is there isn't a medication for systemic heart inflammation. They're actually coming out with one. I think AstraZeneca is coming out with it in like a number of years, but they're just not there yet. But the inflammation is still there. So it's something that that needs to be definitely looked at. And then again, the inflammation is something that causes that plaque to break off and cause a complete occlusion of the artery, which is a direct heart attack. So this is an important test. If you take anything from this talk, it would be this test and ask your doctor for it. It's super standard, but it's just not done, and it's so important. So that's HSCRP. Okay, so we'll talk about what we can start doing today. So one of the things, again, is quit smoking. I won't say anything more about that, but that's definitely a thing you need to do. The other thing is get active. What I like to tell my patients is, do things that, that you enjoy, like hobbies or things like that, or things that get you outdoors. So I like going outdoors. So this photo is me. So I used to be really overweight. I was like 260 pounds. I was on the path for heart disease, and that's kind of when my change happened. And when I moved to Ottawa, I got really into all that hiking and canoeing and camping and all that stuff. So that's me at Booth Lake. And what I love about doing like those outdoor things is it's hard. Carrying a canoe over your head is very difficult. It's like, doing lunges and squats all day long, but then you get to see this. I get to see this like beautiful piece, which helps with my stress management, processing emotions and things. And it's so beautiful. So I tell people to choose what they like to do, and then you'll be more active and less sedentary. So that's an important part. And that's my thing. Everybody can have their own thing, right? And then losing the tummy fat is also one. So I won't go into that. So it's kind of like a weight management lecture. It's different for all people. It's different for women, hormones, men, age, whatever is going on in our body. So, but eventually we should try to decrease the amount of tummy fat that we have. And the last one is stress management. So again, things like that, self-care is really important. Being spiritual is also important for a lot of people. Having people to talk to, support systems, and then also acupuncture is a great way to decrease stress. And things like massage, like just self-care. I have patients who like to do baths at nighttime, and that's just their way to like release and relax. I walk my dog as well, so that's like a stressful relaxation thing for me. All right. close to time, so we'll start getting a little bit faster. So this is heart healthy foods. We have beans, okra, oatmeal, apples, berries, and chia seeds. So all of those are what we like to call soluble fibers. So we have two types of fiber in the body. One that's rough fiber that kind of keeps our bowel movements regular. And the other one is soluble fiber, which sits in our tummy and it actually absorbs like fat and cholesterol. And then instead of going into like our enterohepatic circulation, we just poop it out. So that's what most of these are, these cholesterol-lowering foods. Or soluble fibers like the berries, chia seeds. So like here, like you have oatmeal, apples, and cinnamon. Like it's like a breakfast, right? And then you have berries, almonds, and chia seeds. Those are always in my smoothies all the time. And then you can make like beans, okra, and garlic. The garlic is more specific towards like thinning of the blood. So that plaque that develops. And then the cinnamon also helps with blood sugar regulation. But those are all foods. If you guys want to know foods that you should be eating, I eat them all the time. So it's a good one. Foods to avoid: the trans fats, that triglyceride, that tummy. Like packaged food, basically anything that's packaged. Cookies, baked goods, fried foods like McDonald's, all that stuff, right? That's pretty much trans fats. The next thing is like, in our society, we had a shift of using vegetable and peanut oils like canola and soybean sunflower. So they're pro-inflammatory, and that's where the whole omega-3 thing comes from. You want more of omega-3s versus these. Starchy foods, some people are more sensitive to them, like things like potatoes. So pretty much like don't eat French fries too much. Have them like, in moderate amounts. Simple carbs, things like Coca-Cola, things that turn into sugar really fast, even things like white rice too. And then processed sugars are like sugars that the regular sugar you think about. So my favorite substitute for processed sugars is maple syrup and honey. So we hear a lot about that because processed sugars are very inflammatory. So basically packaged food, like you want to be eating real food, because if it's packaged, it's going to have things in it to preserve it. And those things just don't vibe with our body. They cause inflammation. They weren't meant to be in our body, those kinds of foods. And it's so unfortunate that like they're everywhere. So this is called the Glycemic Foods Guide. So it talks about the sugar in the body. So it's available at diabetes.ca. It's a cool handout. It's meant for diabetics, but I think everyone should be using it. So it kind of breaks down like fruits to like which ones have low amounts of sugar, medium amounts of sugar, and higher amounts of sugar when they go over. So you might not want to eat that first thing in the morning, or you might want to pair it with like in a smoothie or something else. And then also talks about the grains. So like you'll see here, there's like brown rice is here, but then quinoa is here. Quinoa has more protein in it. So this is a guide that's available at diabetes.ca. I won't go into super detail into it, but that's there. I think this is one of the last slides. So this is naturopathic management. So inflammation is a big part of it. So the big part of what we do is the root cause of inflammation. That can be different in a lot of people. So I had a question about the divan. So there are blood pressure lowering herbs in addition to after doing diet and exercise. My favorite ones that have gotten success from like 10 to 15 systolic points, which is the top number, are hibiscus and hawthorn berry. There's hibiscus and hawthorn berry. They work really well. And then I talked about acupuncture for stress management. So acupuncture is a balance of the yin and the yang. So all of the acupuncture is actually rooted in emotions. So in Chinese medicine, they believed that if you had anger, it was related to your liver. If you had other emotions, sadness and grief, if you go through something like that, it's related to your lungs. And once one of those comes out of balance, then we start getting symptoms. So the point of acupuncture is to put the yin and the yang back into balance. And it's done by inserting needles into the dermis of the skin. So if you think of like a prism shifting light, we do a constellation of points anywhere from the feet to like the hands, and you can't feel them. So we tap them in. They're like, 0.2 millimeters in diameter. And then we keep them in and it balances out the body. So that's pretty helpful. And that's actually a lot of what I do is acupuncture. And there are supplements for cholesterol and blood sugar management. So cholesterol, good ones are, there's a red yeast extract that's really good. Berberine also works as well. And then for blood sugar management, we talked a little bit about cinnamon, but there's one called chromium that also works. And there's a couple of herbs. One of them is Gememna. I think, yeah, so that was it. If we have any more questions, I can answer them. And there's my contact information. So I'm at Bright Moon Wellness, which is on Prince of Wales Drive. That's the phone number. And then I also have like an Instagram and Facebook profile and a bunch of other links on this Linktree link. So dr.opal, if you guys want to reach out or anything like that. A lot of the information I talked about is on my Instagram profile or things like that as well. But if there's any more questions, I'd love to answer them.
Yeah, sure. We've got quite a few, so we'll get through as many as we can.
Okay.
The next question is the NMR a separate test, and is there a cost for that type of test?
Oh yeah. So conventional doctors are kind of starting to order it. It's not covered by OHIP. So it's run by LabCorp, which is a company in the US, and the lab in Ottawa that does it is Dynacare. If anybody's heard of them, there's quite a few locations. So they do it, I think it's like $99. And it looks at kind of all the breakdown of everything. That was all the questions, right, about it?
Yeah. Okay, great. And then thinking about prevention of heart disease, what's the difference between being followed by a cardiologist or by a naturopathic doctor?
Yeah, so usually a cardiologist will follow patients who have had a heart event to specialize in looking at how the heart is working. So for myself, I focus more on like prevention. So kind of like what the family doctor would do. I just go a little bit more into detail looking at individuals. But if you want to go to a specialist, you should go to a cardiologist, right? And they can look at like doing those tests like the echoes, if you've had stents put in, things like that. I'm recommending those things because I don't do any of that. A lot of what I do is like lifestyle. So like weight management, like exercise and stress management, and looking at some things that might not be looked at right now. So more like lifestyle, so like general care.
Mm-hmm. Awesome. And the next question from Helen: Can high blood sugar rather have an effect on heartburn?
On heartburn, I don't know. It doesn't. So heartburn is referred to as it's like a burning in the center part area, where kind of like where our heart is. But what it actually is an increase of acid that comes up this tube that takes our food to our tummy. So it's actually occurring in the gut lining, so like the esophagus of the stomach, or the esophagus from the acid from the stomach. So it's not related to blood sugar or heart disease. It can appear as a symptom. It can appear like a symptom of heart disease, but it's not actually heart disease. It's just an overflow of the acid that comes up the esophagus that causes a burning sensation in the area of the heart. And yeah.
Okay, awesome. And then we'll take one more. And for those of you who didn't have your questions answered, you can definitely connect with Dr. Sandip. The last one is, do you have any recommendations on any mineral and vitamin supplements that seniors should consider and daily intakes? Yeah,
so minerals and vitamins. So one that's go-to related to high blood pressure, things like that. So magnesium is a good one. So the reason why I recommend that one for like all age groups and all seniors as well, is it's really hard to get magnesium through our diet. So the best way to get magnesium is leafy greens, which is kind of hard to get, avocados, things like that. But we want to be having around, like depending on your size, about 300 to like relaxation mineral, which kind of relaxes stress. Yeah, and then for vitamins, I'd probably choose B12. So that's a good one to have that's related to a few other things.
Awesome. All right, great. Well, thank you so much, Dr. Sandip, that you were so knowledgeable. Just want to thank you for all that you shared and for tackling all these questions so well. Thanks everyone for